Hello and welcome to Health Live at Seniors Today. We're happy to welcome you on November 1st, 2025, bright and in some places wet or sunny or with awful air quality, depending on which part of the country you are in. But we are delighted to have here with us Dr. Aarthi Kannan. Dr. Kannan is a geriatrician, and those of you who follow Seniors Today would remember that she has written an article for us on October 1st, which is the day for older persons. And today we've invited her to speak about fall prevention in seniors. A little about Dr. Kannan. She has done her MBBS from Mumbai, then she went to Connecticut, she went to Stanford for her super specialization, and she has been a vaccine educator in Kashmir and a healthcare writer as well. We must get her to write more often for Seniors Today. But she's a geriatrician, and she was with the Apollo Hospital in Karnataka before that, and now she is full time with the Hinduja Hospital in Mumbai. Welcome to Health Live at Seniors Today, Dr. Arathi. How are you?
Namaste. Thank you for welcoming me with such a warm welcome. I'm doing very well. I hope you are well and everybody else here as well.
Yeah, we are all well. Thank you. And before we start, and I request you to make your presentation as people are, just coming into the room.
Mhm.
Geriatrics is and it has been around for a while. It's just that in Mumbai we do not have too many, or in India, in general, we do not have too many geriatric specialists. Is that correct, or uh, is that an incorrect assumption or statement? And if it is correct, then why is that so?
So it's true that we don't have many formally qualified super specialty trained geriatricians. That is true. But the practice of geriatrics has been around for so long because who has been taking care of older adults when qualified super specialty trained geriatricians have not been around? It is internists, it is other orthopedic surgeons, it is general surgeons, it's cardiologists. So the onus of taking care of geriatric patients actually rests upon everyone, and it has been fulfilled to a large extent by the doctors who have already been in the system. Now, the need to deliver that specialized care that's very tailored, very personalized, that looks at older adults, gives them the time they need, that is something that formally trained geriatricians are particularly equipped to do. And that's what today needs. And it's true that we don't have many of us yet.
And this is a question which I'm sure somebody or the other would ask. But if a senior needs to go to a doctor,
Mhm.
of course there are specializations that are available.
Mhm.
But would the first call hence be to a geriatrician? Is that what you recommend?
So it depends on the complaint, right? Like if it's an emergency situation, it's always the emergency room. It's not anything else. So,
Right.
like life and safety first.
That's
And
right.
if it's a primary care or an outpatient related issue, which is non urgent, where you can actually go to the clinic and see a geriatrician, then a first point of contact could be a geriatrician.
Great. So without any further ado, we have around 180 odd attendees already on the Zoom room, and I'm sure there are a good number of others on our YouTube channel. So over to you, Dr. Aarthi. Do remember, all of you, that even as she's getting her presentation ready, you can get your presentation ready in the meantime, your screen share. Even as she's getting it ready, do remember that the advice given here is advisory in nature. In case you do have any specific issues, you must visit a doctor in your city, in town, wherever you are, and take the advice. Also, do remember you don't have to take down notes. This video will be up on our website, that is seniorstoday.in, on Monday, and you can watch it over there. And the presentation will be there as part of the video. Over to you, Dr. Aarthi Kannan.
So, today we'll be speaking about preventing falls as we age healthily. A lot of senior citizens, as well as your children, your families, one of the biggest concerns around aging is how to stay independent and how to prevent falls as we grow older. It's not just about, disease prevention or managing chronic ailments. It's about actually staying healthy. It's about staying independent, trying not to depend on anybody for anything. And that is what makes a full life. So, I'm here to talk to all of you today about this topic. And as we already know, fall prevention is something that's picking up pace in many specialties, not just in geriatrics. You have, neurologists talk about it, internal medicine specialists talk about it, physiotherapists talk about it. So there's a lot of attention to this topic. And that brings us to why are we talking about falls? Every year, it is estimated that about 1 in 3 adults over the age of 65 fall. And this is Western numbers. To extrapolate that to India or Mumbai, the local numbers may be slightly different, but the principles are the same. So, in those over 80 years of age, the risk of falling is even higher. The consequences of falls are hip fracture, head injury, loss of independence, fear of falling, and social isolation. And why does social isolation happen? Because we are worried about falling. We don't actually end up going out as much as we ought to. We lose our strength and thereby end up just being alone at home. So, reducing fall risk is equal to preserving mobility, autonomy, and quality of life. So, this is something that we need to get in our mind is that it's not something to be taken lightly. We can't say, okay, I'll take care of it when I get there. Preventing falls is you have to be fully proactive and know exactly what needs to be done. So, what are the consequences of a fall? We spoke about fractures just a little bit ago, like about hip fracture, wrist fracture, head injury, soft tissue damage. But other than that, you have loss of mobility. After a fall, many older adults, I've seen them reduce their activity, leading to muscle weakness and decline in their balance. Then there's the psychological fear of falling again. So one of the things I see, my older patients when they come to clinic and they say they've had a fall, the first thing they say is, I'm afraid I'm going to fall again. So that's called as the fear of falling. That again leads to reduced activity and social withdrawal. The economic health system consequences are increased hospitalization, cost, and caregiving efforts. For Mumbai seniors, the impact on living at home independently, because we live in small apartments, on stairs, the fact that we don't live on ground floor homes, all of us, we do have to climb stairs in many of the old buildings that we reside in compact homes, navigating older neighborhoods, older buildings. Who is most at risk? The key risk factors are if you're 65 or above, and the risk increases as you grow older. So, age is a risk factor. The history of a previous fall is the single strongest predictor of a future fall. Lower body weakness, poor balance or gait is another risk factor. Visual impairment or inability to see well. Hearing issues, medications that affect balance or cognition. Home hazards like loose rugs, mats, poor lighting, and obstacles in the path like cluttered corridors, cluttered hallways, objects that are strewn around on the floor. Chronic conditions like arthritis, Parkinson's, memory or cognitive disorders are also risk factors. Environmental and contextual factors in Mumbai homes are stairs, uneven surfaces, and lighting issues. So many times we don't have lights on the staircase that lead down. And getting out in after hours in the evening or nighttime is risky. Major causes of falls. So if we go with the first part, the major causes are physical and musculoskeletal. So muscle weakness, especially in the legs, it makes recovering from a stumble harder. So when we're young, we kind of catch ourselves easier when we fall. But when we are older, the muscle weakness that sets in as a part of aging is something that automatically puts you at a risk of recovering poorer from a stumble. You're more likely to land up in a fall if you stumble as you grow older. Balance problems like inner ear issues, neurological issues can lead to this. Gait changes, Shuffling, slow, unsteady gait can lead to falls. Joint pains like osteoarthritis, hip and knee problems can lead to a change in the way we balance ourselves when we walk. It can shift our center of gravity and put us at a higher risk of falling. Postural hypotension, which is basically a term for drop in blood pressure when we stand up from a sitting or a lying down position, that can cause dizziness. Sometimes we feel dizzy when we stand up too fast or stand up suddenly. That's postural hypotension. Foot problems or poor footwear, slippery soles and sandals, they can change the traction and stability we feel when we put our foot on the ground. Decline in vision, cataract, low light adaptation, which are all parts of aging, can change how we perceive the environment and how safe we are. In Mumbai, in many older homes, the narrow stairs, lack of handrails when we're climbing downstairs or even walking around in slippery areas like bathrooms. So your muscular and skeletal aspect, as well as the environment, have an interaction here that kind of leads you down a path of higher risk of falling. The second part of major causes of falls are medications and vision or neurological. Many drugs increase the risk of falls by causing dizziness, increased sleepiness or sedation, low blood pressure, confusion. For example, sedatives, there are some antidepressants, antihypertensives, and some antipsychotic medications which are used in older patients. Polypharmacy or taking many drugs increases the risk of falls. Medication review is the key here. Pay careful attention to side effects like dizziness and drowsiness. Don't just wish it away or say it'll go away, it'll be fine. If you were recently started on a medication or new medications, multiple new medications, and you're experiencing new dizziness or drowsiness, you need to ask yourself and ask your doctor if this is related to those new medications, or is there an interaction between a new medication and an old medication that could be causing this. The other aspect is the vision, neurological, or the cognitive aspect. So, impaired vision, cataracts, glaucoma, hearing impairment also contributes. The newer guidelines actually mention hearing impairment as a significant risk factor. Cognitive decline or dementia, memory issues, memory disorders. People with mild to moderate cognitive impairment fall more often than people who don't have cognitive impairment. Neurological conditions like stroke, Parkinson's, neuropathy, which is the a disease of the nerves in our peripheral in the body, such as in the legs, in the feet, which affect the way we stand and walk, which affect the way we sense the ground, the way we sense position and sense where the ground is. All of these things can also put us at a risk of falling. Part three is environment and behavior. How do these things cause falls? Home hazards like loose rugs or carpets, mats, poor lighting, cords which are running around, those extension boards and cords of lamps which are running on the ground, clutter in places, open, Amazon boxes or whatever there might be. I've seen a bunch of things on the home visits that, lie on the floor of the elderly patients in their homes. So all of these things can put them at a risk of falls. Slippery floors, tiles, bathrooms, all of these things also increase the risk of falls. Lack of handrails, stair rails, steps without markings, inadequate lighting, footwear, which are slippers, flip-flops, very soft soles, which also increase the slipping risk. Behavioral measures such as rushing, looking at the phone while walking, texting while walking, looking at videos while walking, trying to multitask, walking on unstable surfaces, thinking, oh, it's fine, it's just one step, I'm going to take one step on this uneven surface, I'll be okay. So that's not recommended. In Mumbai, stairs in older buildings, narrow passages, wet monsoon floors, these are the riskiest things to keep in mind. This is where the environment and our behavior interact to put us at a risk of falling. So, in screening and assessment, what seniors as well as doctors should ideally be going through is the guidelines say that all older persons should be asked annually on their doctor visits about whether they have fallen in the past 1 year. So, what do geriatricians do? We, as geriatricians, we ask about the frequency, the circumstances, the walking or balance problems. So, if you do have a fall, we ask you about the details of the fall. We ask you if you have any walking or balance issues. And we go over gait and balance assessment with tests like the timed up and go test. We review all your medications, your current medications, everything you're taking, vision, your hearing, basically, like just a screening. And we ask you to go for a detailed visual and hearing examination if we suspect that you may have an underlying visual or hearing issue. And we also ask you about your home environment to understand a little bit more about whether your environment might be causing your risk of falling. We also ask about near falls. A near fall is an almost fall, which is I almost fell, but I grabbed something, so I didn't fully fall. So that's a near fall. That's also risky. So ask yourself three questions. Have I fallen or nearly fallen this year? The second question is, am I unsteady while I'm walking? The third question is, do I feel dizzy when I stand up or move? Evidence-based interventions, what works? The most important thing is exercise and physical activity. Exercise is the most important message. There's aerobic exercise, there's also supervised exercise programs, both of which are good, and it really should be personalized to what you need based on your unique risk factors. So, balance, gait, and strength training in the form of group classes or supervised home exercise programs reduce falls. Tai Chi, for example, is shown to improve balance in older adults, standing and walking balance. Even chair based exercises can be effective if done correctly and done with supervision and from a licensed medical provider. In Mumbai, we have older adult yoga classes, Tai Chi sessions, walking groups in parks, which I've seen a lot of, home exercise programs as suggested by a geriatrician or even a physiotherapist. The key is that you have to be consistent about it because the moment you lose that consistency, you lose the gains from the exercise. Avoid purely low effort activity. Some folks do just stretching and they think that that's enough, but stretching actually doesn't contribute to meaningful fall prevention. You do have to challenge your balance and leg strength in order to really make meaningful progress from a fall prevention standpoint. Evidence-based interventions, what works in the home and environment and medication review standpoint. So in the home and environment front, remove tripping hazards at home. Install handrails, grab bars, especially in bathrooms. Improve lighting. Use non-slip mats, the ones with the rubber underneath. That's really important because if you have the slippery mat, it can just slip on the floor. And I've seen so many people ending up with a hip injury or a spine injury just from this kind of usage of slippery mats. For bathrooms, raised toilet seats, shower chairs help a lot. Shower chairs are incredibly useful in preventing slips in the bathroom. Supportive footwear with non-slip soles, medication review and other medical interventions. So from this angle, review all your medications, both prescription and over-the-counter, supplements, non-prescription medication, everything with your doctor periodically. De-prescribe whenever needed. Ask your doctor periodically if you can remove any of your medications, whether they're all absolutely necessary. Manage blood pressure, postural hypotension, foot problems, vision, and hearing issues. Keep an updated medication list. Every month, go through your medication list, add or remove whatever has been changed, and make sure you change the dose and the frequency if any changes have been made by your doctors. Bring it to all your doctor visits. Have a neat list and bring it to every single doctor visit. Assess home hazards, especially in monsoon season. Look at the stairs in small flats. Just be really careful that you're not adding to any clutter. What works from vitamin D nutrition, vision, and hearing check standpoint? So, vitamin D supplementation at least 800 international units daily, and this is on its own, not in addition to other vitamin D and calcium supplements. So, vitamin D supplementation 800 international units per day may be considered for older persons with gait and balance problems or high fall risk, especially when the blood test shows a vitamin D deficiency. Balanced nutrition matters. So, getting adequate protein, regular meals, and hydration is important. Vision and hearing, annual checks are recommended. Impairment increases fall risk. So, if your vision or hearing are impaired, definitely the risk of falling goes. The 9 step fall prevention plan, if I were to give you a fall prevention plan, this is what it might look like roughly. So, this is just a basic outline. And if you have any independent risk factors, you should get them assessed medically and taken care of and treated. So, the first one is screening. Ask yourself, have I fallen or almost fallen in the past 1 year? Second, exercise. Choose an activity 2 to 3 times a week, focusing on legs, balance, and gait. For example, walking, tai chi, yoga, or home physio. But first, make sure that you're okay and stable enough to exercise from your doctor before you go ahead and join an exercise program. The third one is medication review. Bring the list to the doctor and ask, could any of my medications be affecting my balance or making me more sleepy or drowsy? This is a very important question. Home check. Walk around your home and even outdoors, like just outside your main door, and check for hazards actively. Look for rugs, cords, look at the stairs, look at the lighting, look at your own footwear. That also matters. Vision and hearing review. Book an eye test and hearing check. Ideally, at least every 6 months or every yearly, depending on your risk factors, and sometimes even more frequently if you do have active risk factors contributing to these issues. Footwear, wear flat fitted non slip shoes when you go outside. Avoid loose slippers or socks alone. Nutrition and health, stay active, eat well, maintain healthy weight, avoid dehydration, get sun exposure for vitamin D, and check your bone health if required. There are a lot of people with thinning of the bone, with fragile bones, osteopenia, osteoporosis, who are at a higher risk of fractures when they fall. So it's important that you have this also addressed so that you can have stronger bones. In follow up and support, if you feel unsteady, consult a geriatrician and join local group exercise, senior activity groups, community centers, and park walking groups. Get support. Make sure that you follow up with the doctor, get support as well. Special precautions, monsoon precautions for wet floors, like we spoke before, stair use awareness in older buildings. So, if we had to go through a checklist of what are all the things you need to do next, first one, keep a fall log. If you're at risk, if you're having a near fall or you've had any falls, maintain a log of what happened, when it happened, where, and why you think it happened. If you're safe to stand up from the chair, slowly stand up from the chair without using the arms. And if that is difficult, if you find that difficult, talk to your doctor about why this is happening or why they think it's happening. Home checklist. Remove rugs, use night lights in corridors and in the bedroom, install handrails by stairs and in the bathroom, non-slip mats outside the bathroom, cross doorways slowly. Because in our doorways at home, we have a little step between one room and another room, for example, between the bedroom and the bathroom. So you don't want to trip even if you're sleepy or in the middle of the night when you get up. So cross slowly. Just make a habit of crossing doorways slowly. Keep frequently used items at reachable height and right next to your bed when you sleep. Medication review every 6 to 12 months. Ask yourself, ask your doctor, ask your geriatrician, what are the side effects of my medications? Is there anything that could contribute to dizziness or sleepiness in any of these? Is there any chance we could change them? Is the risk more than the benefit of taking this medication? Exercise schedule, Mondays, Wednesdays, Fridays. Just go for 15 to 20 minutes of leg and balance exercises. Learn them first, learn them properly, and then go for it. And then a daily 30 minutes walk. Wear good footwear, full sole, closed toe, non slip. Avoid rushing. When you stand up from the bed or stand up from the chair, just do it really slowly. And once you stand up, take a few seconds before you take the next step, maybe 30 seconds to a minute. And especially if this happens after lying down, not just sitting down, if you're lying down and then you get up, be really careful. Take it slow. Keep vision and hearing appointments yearly or sooner if there are any changes. If you do fall, don't ignore it. Tell your doctor because I fell once is a red flag. Encourage family involvement. Children, grandchildren can help look out for hazards and they will support your exercise if you ask them for it. Use local senior clubs and peer groups for motivation and safe group activity. The reason group peer groups work is because we meet people who are having issues that are similar to us. And many times we get useful information from people who are our age. And that's why group therapy helps a lot. My recommendations as your geriatrician, I recommend that you make this your fall prevention plan this coming month. This is a very generic one, but I encourage you to pick 2 to 3 items from the checklist that we just went through. Start them this week. If you have any doubts about whether you're safe to do any of them, ask your doctor. Footwear, home lighting, walk schedule, those are just 3 out of the many things that we just went through. But just pick any 3 items and just start them this week. Stay engaged. Keeping moving is one of the best things you can do. Encourage your children, family members to support you, ensuring that your home is safe, that you attend your checkups regularly, that you have company in exercise whenever you do exercise. If you feel unsteady or you've had a fall, meet with a geriatrician. Try and find out why it's happening so that you can be at peace. So, I want to let you know that fall prevention is not something that is not preventable. You can prevent and reduce your risk of falls, especially if you have risk factors that can be addressed. So, please do address them. I want to thank you for being here, and I'm open to taking any questions.
Thank you very much. Thank you very much for an amazing presentation. I think a lot of questions have already been addressed, but there are a few questions that have come in, uh, and I'm going to start taking them. So, you have already addressed this, but Shamla Ravi asks, what are the red flag symptoms after a fall?
So red flag symptoms after a fall are many. I can just enlist a few things that are absolutely meant to look out for. If you lose consciousness or you nearly lose consciousness or you feel drowsy, if there's a headache, if there's pain, acute pain in any part of the body or inability to move a part of the body, if there's loss of sensation or loss of strength in a particular part of the body after a fall, if there is any seizure-like or fit-like activity, any of these are red flag symptoms. There are many more, but these are the things that you really need to look out for.
And a similar question by Anupama Singh, but she's also asked, how can I make sure I get up safely if I do fall?
If you do fall, so first of all, figure out if you are able to get up. That's the first thing. You have to be able to stand up. Many people who injure themselves or injure their bones are not able to stand up. That's the first thing. So, if you're able to move all parts of your body, you're not having any new pain, significant pain that stops you from getting up. Reach out for an object, a stable and a heavy object that's at a low level. Maybe a bed would be good. So if you've fallen next to the bed, that would be you can use your bed for support and then stand up. But importantly, move your legs in a way that would allow you to rise with both legs together if that's possible, because again, that would keep your stability better than rising on a single leg. One of the things that I always advise people not to do is don't hold a vertical surface or a wall when you're trying to get up. Hold something horizontal and something stable, something heavy.
All right. We have another question from Sunita Verma who asks, I'm very scared of falling. Should walking bare feet, is that advisable?
So walking bare feet, no, not walking bare feet is really dependent on your own risk factors. There are people who have neuropathy. It doesn't matter they walk bare feet or walk with shoes. There is still an inability to perceive the ground. It's a sensory abnormality. So you will continue to be at risk of falls regardless. So if you're having difficulty perceiving or sensing the ground, you should see a doctor for that and have it evaluated. Have your nerve, especially your nerve sensation in the feet evaluated before you go ahead and decide what to do. You can walk bare feet if you're comfortable, if you don't have a foot deformity or foot pain. But if you have any doubts, check with an orthopedic surgeon and your physician before you go ahead.
Right. There's a specific brand which is mentioned by Parveen Kumari who asks, does Dr. Shawl footwear help prevent falling? Or, Shailaja asks, what kind of ideal footwear, if any, would you recommend to prevent falls?
So, I mean, we
In fact,
don't have to
I'm
go.
going to pause here. There's a larger question that has also been asked. Doctor, you mentioned about various grab bars, etc., that are there. While if you do go to any of the e-commerce sites, there are quite a few available. But which ones are the right ones? How do we know that what is available is the right thing to buy? Is there any recommendation that a hospital like yours would make?
So we typically do not, I mean, I also personally do not endorse anyone, any single agency. What I would say is look at somebody who does the entire, like who does an entire fall prevention installation. There are a lot of good companies online who do it. Look at the number of years that they've been in the business. That's what I would look at if I was doing this. And look at somebody who's close to you, who lives in the same city, who can come and assess your home. So, one of the green flags is that they actually come and do an assessment of your home and they have an idea of what needs to be done. Do a little bit of research. We just spoke about what all needs to be done at home: grab bars, side rails. Making sure that you have good lighting. So, a good person would come and assess first. They wouldn't be price first. They would come and do a full assessment and then give you a quote as to what needs to be done. So, try out multiple options and see how comfortable you feel before you go ahead. That's the first thing I would say. I think the other question was, you had a question before that. I'm sorry, could you repeat?
Yeah, this is about the footwear. Which footwear is the right one to?
Okay. So the type of footwear that's good to wear in general, and I'm talking about if you don't have any particular foot issue, you don't have neuropathy, you don't have any anatomical deformity in your feet. So good stable shoes to wear outdoors would be a shoe that is closed toed, which means that it covers your toes. You don't want anything stubbing your toe, especially because that can hurt and can also cause a trip. And you want something that covers your entire foot and has a good tread on it. So if you look at the underside of your shoes, you don't want a shoe that's worn out because it's lost its tread and it tends to slip more easily. So replace your shoes more frequently. Make sure it is not something that is slippery, especially on wet surfaces. Ask when you go to the store, ask them whether this is stable for running and walking, because those kind of shoes have a good tread, they have a good amount of friction underneath. So those are generally good shoes.
You mentioned about the fact that there could be somebody who may come home to do a check about your senior readiness of your apartment or your house. But are there people like these who are available?
So there are two aspects. One is the medical aspect, right? There are geriatricians, physical therapists also who come home and do a home safety assessment. And that is more medical than anything else. They not only look at the architectural and the engineering aspect of it, but they also tell you things like whether you have enough lighting. They look at whether there's any clutter in the corridors, whether the bed height is good. So there are these aspects that a medical person knows that somebody who's just into fixing, putting fixtures, safety fixtures around the house may not necessarily be able to do. So yes, there are physiotherapists, geriatricians, even many general practitioners are now getting into the habit of doing home safety evaluation. It's called as a home safety evaluation, a medical one. And then you have those folks who come in and do the fixtures. They do a separate assessment. They see as to whether it's even feasible, whether it's safe to put in. So, for example, you may want to put in a side rail or a grab bar, but does your bathroom structure actually allow it? Is it going to just rip off when you try to put your body weight on it? So those are things that a more of an engineering architectural person would be able to do, and those are the people who probably come from those companies.
And are these people, geriatricians or family physicians or physiotherapists, do they exist in a city like Mumbai, Bangalore, Delhi? Are these?
Absolutely, absolutely, yes. In fact, that's something that we are trying to improvise on and try to offer as a formal thing for elderly people. Because one of the things that I see seniors being more proactive about is please help me. I want to prevent falls. I want to maximize my wellness. So, based on that need, we are improvising to create those home safety evaluations from our hospital as well.
Right. We have a question. We have a mention, a statement from Bomi, who says, "Would walking bare feet in the house help as we can get a feel of whether the floor is wet or not?"
So, yes, particularly in Indian homes, because we don't live in a Western nation, so there you have your carpets and dry floors, wooden floors, all of those things. There's very little water movement that happens outside the bathroom and the kitchen sink. But in India we have a lot of water moving around the house. You tend to have water droplets here and there. So practically, if you had to adapt those measures here, one could argue and make a case for walking bare feet. So I wouldn't blindly say walk shoes wear shoes wherever you walk, even if it's inside the home. Sometimes that perception of a wet floor or a slippery floor or even oil drops on the floor or even sensing the floor is very important. We also have mosaic in many of the homes, older homes, which are much more slippery than some of the anti-skid tiles which exist in the new homes. So all these are nuances that we need to take into consideration, which is why I don't ever blindly say that indoors you should wear shoes. There is no such thing. Important thing is if you have any anatomical or neurological issues that prevent you from sensing the floor, that is what needs to be addressed more than the shoes itself.
Right. We have a question from Shobha. I'm on a blood thinner. Sometimes I feel that I'm walking diagonally. What may be the reason?
I'm sorry, Shobha, you will have to help me understand that question a little better.
All right. I'll just wait for her response to come in. This is from Aarthi Ghosh, the next question. My toes have become senseless. So without any sensation, I feel unbalanced and fear falling whenever I get a stumble anywhere. What should I do?
So, Aarthi, right?
That's right.
So, Miss Aarthi, have it evaluated medically. There are a multitude of reasons why you may not have sensations in your toes or why it's been declining. Other than diabetes, B12 deficiency, there are other factors which can lead to this. So, have it medically evaluated. Understand whether there is any reversibility, whether it can be treated. Because some of these causes can actually be treated and are reversible, some may not be reversible. So, have it evaluated, understand, and if at all it can be reversed, you also reduce your risk of falls.
Right. Um, we have, let me see if she has responded. No, she hasn't responded. There's this is a question from Rashmi Verma. I had a fall 2 months back. I feel lack of energy and sleepiness all the time. What should I do?
So so you had a fall and you feel lack of energy and sleepiness all the time.
Right.
Meet with your internist or GP or a geriatrician. This is important because feeling like you don't have energy, already having fallen, we spoke about how having one fall itself is a red flag because that alone is a single most important predictor of future falls. So, have it evaluated because, see, one of the other things is low energy, feeling sleepy. Is this a medication that is causing it? Is it an underlying medical condition that's causing it? There are so many reasons it could be happening. So, have yourself physically examined and evaluated. Have someone review all your medications thoroughly, your supplements, everything. So, if you see someone in the clinic in person, that would be the most useful thing you can do to yourself.
Right. Thank you. Mr. Jambunathan, I think we've answered your question. And yeah, doctor, I think we've answered most questions now. Thank you very much uh, for being here on this session. And to those of you who a couple of people asked me about your article, so I've put the link on the chat. This is the article that Dr. Dr. Kannan wrote on October 1st on the Seniors Today website. Um, Thank you very much, Dr. Kannan, for this session on Health Live at Seniors Today. It was a pleasure having you there. And since now I know that you are also interested in writing, I'm going to, you know, uh,
For
chase you
sure.
for some more articles off and on because we are seniors today, and you are a senior geriatrician. So, it is in a sense the magazine, the publication, and the platform, and yourself are made for each other, if I might say. So, thank you very much for being there.
Pleasure.
And thank you to all of you for being there. And thank you to the team at Hinduja Hospital to facilitate this. We will be back once again next Saturday at 5 p.m. We are working on the next issue of Seniors Today. And I must tell you that the next issue of Seniors Today has a special article on polypharmacy, which is, which you mentioned about. So do take a look at that. And that's on the 15th of the month. As always, do remember that there are a host of activities that we do as part of the Evergreen Club. There's no issue. There's no Seniors Have Talent that is there next week, but the finale is coming up on November 16th. So do watch out for that. And of course, the magazine and the website, keep tracking that. Thank you once again to Dr. Aarthi Kannan for being here, and have a nice weekend, all of you. Thank you. Bye.
You too. Thank you. Bye.
Subscribe now and press the bell icon. Never miss an update.